healthy lifestyle.
Tooth pain is often dismissed or it gets treated too late, but many patients don't realize there's a dental specialist that's uniquely qualified to diagnose and treat the most common causes of tooth pain, infection, and inflammation, and that is an endodontist. Joining us today is Dr. Katz, President of the American Association of Endodontists. And Dr. Katz, thanks for being here with us today. So what exactly is an endodontist, and how are they different from a general dentist?
Sure. Well, thank you for having me. An endodontist is a dentist, but we have 2 to 3 years of additional training and education. We focus on the inside of the tooth, so the nervous tissue, the root, and the surrounding structure. You would know us as the root canal specialist, but it's really much more than that. We are the tooth saving specialists. That means we take care of patients that are in pain. We help patients avoid unnecessary extractions and costly additional procedures.
So when should a patient see an endodontist?
Well, you should see an endodontist if you have pain or swelling, hot or cold sensitivity, if you've broken a tooth, or if you've had trauma to your teeth. But remember, there's no amount of pain or swelling in your mouth that should be considered normal. So if you're not sure, ask your general dentist for a referral, or you could go to findmyendodontist.com and you could go directly to an endodontist in your own neighborhood.
Well, Dr. Katz, you mentioned root canals. I know in TV, movies, even in cartoons, they look really painful. Is that true, or is that just a myth?
That's really one of the biggest myths in dentistry right now. Root canals are not at all painful. Having a root canal procedure is really no different than having a routine filling done at your dentist. We use new techniques, new improved technologies, and we have better local anesthetics now that make the procedure comfortable, quick, and most importantly, pain-free. Very frequently, our patients will tell us how easy the entire process was. We like to say, this is not your grandmother's root canal.
And Dr. Katz, why is saving your natural tooth better than removing it?
So it's really important to save your natural teeth. Nothing functions, looks, or feels like a natural tooth. They are so important for the ability to speak, to chew, and for our all-important smiles. But it's really much more than that. We now know that if you maintain healthy teeth, that you'll reduce your risk for cardiovascular disease, improve diabetic scores, and you also improve your cognitive function as you age. In short, saving your teeth is not just about comfort or cosmetics. It's an investment in your long-term well-being and health.
Well, if a tooth infection is left untreated, how can that affect our overall health?
Well, there's really brand new research that shows that when you have an infection in a tooth and you treat it with endodontic therapy, that you can actually improve your cholesterol numbers and your blood sugar numbers. So really, you're improving or reducing your risk for cardiovascular disease and diabetes. There's much more research that needs to be done on this topic, but one thing has become abundantly clear. The connection between oral health and systemic health is very real. If you take care of your teeth, you will have better overall health. So please do not delay. It's important that you get to the endodontist as soon as you can.
Well, this is a lot of great information, Dr. Katz. Where can our viewers go to learn more or to find an endodontist?
Well, if you go to findmyendodontist.com, there's all kinds of information about saving your teeth. And on that site, you can also find an endodontist in your neighborhood.
All right, Dr. Katz with the American Association of Endodontists. Thanks again.
Thanks for having me.
Have drafty windows?